My name is Lena Patton. I am CPR and First Aid certified through the American Heart Association and the Red Cross. I was certified as a lifeguard 2 years ago and will be recertified next summer. Today I'm going to be teaching you some hands-only CPR in adults and infants. CPR stands for cardiopulmonary resuscitation. It is used commonly for cardiac arrest and heart attacks. CPR can be done by anybody, and everybody's protected through the Good Samaritan law as long as you're doing things within your training. So today, I'm going to be teaching you how to do CPR on adults, infants, and children. So the first thing you do when you come up to a scene is make sure the scene is safe. You want to make sure that the patient is not collapsed due to chemicals in the air or gases in the air, or they didn't get electrocuted and there's still the chance of you getting electrocuted, or they're in a puddle of water that has an electrical cord in it. The first thing you want to do if there is an electrical situation is find that source. So if it's a cord the baby was chewing on, you're going to follow the cord back to the plug-in, you're going to quickly unplug it, and then you're going to go back to the baby to assess the situation again. So here, the scene is safe. You're going to walk up to the patient, you're going to tap them vigorously on the shoulders, and you're going to ask, "Are you okay?" You want to do this very loudly so they can hear you. If you do it too quietly or not enough, it's going to be like trying to wake up your baby brother that doesn't want to get up, and you're like, "Come on, like, are you okay? Are you okay?" You want to be, "Are you okay? Are you okay?" And obviously if they don't respond, they're not okay. You're going to then check for a pulse and breathing. You're going to check breathing in 2 ways. You're going to put your head down to their mouth to feel breathing on your ear and face. And as you're doing that, you're going to be turning towards their chest so you're watching for chest rises, and so you're watching to see if their chest rises. Then, if you don't see any breathing, they most likely don't have a pulse, but you're going to check anyways. You're going to take your 2 fingers, you're going to place it on their pulmonary artery underneath their chin area, like by their ear and underneath their chin. You're going to feel it, you're going to give it a few seconds. You're really going to have to press in there, because if you kind of just lightly put it on there, you're not going to feel anything. You're going to put it in there, you're going to wait a few seconds, there's no pulse. Then, if you're in a crowd, you can then point and be you in the blue shirt, "Go call 911. The reason why you want to point somebody out is if you're in a crowd, you get the crowd effect, where you say, "Someone call 911. Either everybody's going to call 911 or nobody's going to call 911. The next thing you're going to do is point to another person and say, "You in the red shirt, go get an AED. Their sole job is to go find an AED. If an AED is present, that is golden. That jumps the survival rate of the patient by 10%. CPR alone jumps the percentage to either double or triple the survival rate. Any CPR helps. Today we're just going to be doing hands-on CPR, since it is in the time of COVID and you don't want to give somebody mouth-to-mouth without the protective gear. So the first thing you're going to do after you checked vitals, you checked for pulse, you checked for breathing, you're going to begin your CPR. You're going to go from underneath their armpit, you're going to drag it across, and roughly in the middle of their chest is their sternum. You're going to then take the palm of your hand, place it on their sternum, you're going to take your other hand, and you're going to interlace your fingers. This is going to give you a better grip over where your hand position is, and it's going to give you more force since you're using both hands instead of just one. From there, you're going to put your entire body over top of the patient, and you're going to begin compressions. Compressions should be roughly 100 to 120 beats per minute. Some songs that people refer to for timing is "Staying Alive," "Another One Bites the Dust," and a new one, "Baby Shark." So you're going to begin compressions for roughly 2 minutes or until you get tired. So then now we're going to begin. So you do 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10 and 11 and 12 and 13 and 14 and 15 and 16 and 17 and 18. So now 2 minutes have passed. You're going to reassess the patient. You're going to see if there's a pulse. You're going to check for breathing. None of those are present yet. The person hasn't returned back with the AED. So then you're going to begin compressions again. Remember that your compressions have to be roughly 2 to 2.4 inches deep to be effective. The reason for that is that the adult body is a lot thicker and there's more pressure that needs to be applied to actually get your heart pumping. The reason for CPR is to just get the circulation of the heart going again, so then the circulation of blood reaches the brain and then back down. Every 10 seconds that you stop doing CPR, it lowers every minute done without doing CPR lowers the survival rate of the patient by 7 to 10%. So it's very important to keep going with your compressions until an medical emergency dispatch get here. So you're going to keep going until someone brings an AED. And if you're all by yourself, it's okay, you don't need one, you just need to keep going and make sure that you have 911 on the speakerphone sitting right next to you. The 911 dispatcher will help you through the process of, if you have an AED, applying the AED. They will also help you with the rhythm and will keep time for you. It's important to keep the dispatcher on the phone so they can update you where the ambulance is and can help you through the process. So the person comes back with the AED. The first thing they're going to do is they're going to open it up. They're going to turn it on and going to say, open up the paddles. Sometimes there are two sets of paddles inside of the AED. There's an adult set and there's an infancy child set. The infancy child set is going to be a lot smaller since their abdomen isn't as large. But sometimes they only have the big adult ones, which in our case, this AED only has the larger ones. And later I'll show you how to apply adult AEDs to infants. On the AED, it shows you on the paddles where to apply them to your patient. For an adult, there's on your side and on your shoulder chest area. So you're going to go ahead and apply them. And this can all be done while somebody is still doing CPR. If you're by yourself, just make sure you do it quickly and make sure that the pads are firmly pressed down. Now the AED is going to say assessing patient. Make sure nobody's touching. So the reason why you don't want to be touching the patient is because the AED is testing the electrical charges inside the patient. So if the heart's not pumping, there's going to be lower amounts. It's going to have an irregular heartbeat. And so it's assessing. It's going to say shock advised most likely. Then you make sure everybody's clear. You say clear. Make sure everybody says clear back if they're helping you. If you have two people doing CPR, make sure the other person says clear. You're going to then give them the shock. It's going to say shock addressed. And it's going to say begin CPR again. So you're going to go ahead, find that center underneath their nipple line near their sternum, and you're going to begin that same quality CPR again. The AED is going to have a metronome beeping sound that's going to count your 100 to 120 beats per minute. And it's going to keep your 2 minutes as well. So you're going to begin CPR, 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. And it says stop CPR, reassessing patient. So that everybody's clear, puts their hands up. It's reassessing the patient. Says shock advised, deliver the shock, begin CPR. So you're going to keep going until a medical emergency professional gets here and they can take over for you. An important thing that you need to do is mark what time you started chest compressions, with either checking whoever called 911 to see what time they called, or if you happen to have a Sharpie or a pen or some sort of writing utensil, you can write it on the patient's arm. You can write it literally anywhere on them. Just try not to get on their clothes. Now we're going to go into how to do CPR on an infant or a child. So the process is the same except for a few things. So again, you come across the scene, you're going to make sure everything's safe. No electrical wires, no chemicals, no gases in the air. The scene is all safe. You can then go up to the patient. You're going to check them again. You're going to be, hey, are you okay? Are you okay? Are you okay? Very vigorously. And you're going to tickle their feet to see if they have any reaction to that. If they start crying or they laugh, they start breathing. So now you're going to check for breathing. Same thing. You're going to put your head next to their mouth. You're going to look at their chest to see if there's any rises. You're going to check for the pulse. Underneath their neck, you can try there, or you can try on their wrist, since babies don't usually have a large neck yet. So there's no breathing, there's no pulse. You're going to begin CPR. In a child, it's in the same spot, but you only use one hand. You use the palm of your hand, and you're going to begin CPR. Same 100 to 120 beats per minute. So you're going to begin 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8. If you have an AED present, someone brought you an AED, but it only has adult paddles. In the AED, we'll tell you how to address those to infants and children. You're going to put one paddle on the front. Make sure it's on there. You're going to put one paddle on the back. It's going to assess the patient, make sure everybody's clear. They shock advise. It's going to automatically know if it's a child or not, based on where the paddles are placed. You give it a shock, make sure everybody's clear, and then begin CPR again. So you're going to keep doing that. You do the same thing for an infant. You vigorously tap them, tickle their feet to see if anything happens. You put one paddle on the front and one paddle on the back if there's an AED present. Usually with infants, they're more respiratory driven and they need more oxygen. So with infants, you can give them rescue breaths. So as a rescue breath in an infant, it's 30 compressions to 2 breaths. Immediately when you get the patient, or you find the baby or infant, you're going to immediately give them those 2 rescue breaths if you found them unconscious. After that, you're going to begin CPR. You're going to have 911 on the call. You're going to continue doing CPR until the EMTs get there and take over for you. If the baby happens to be on the stairs, you are totally okay to pick up the baby and bring it upstairs, because you know that's where the EMTs are going to have to go. So after the EMTs take over, you're going to tell them what time you started, how long you've been going, when did you begin shocks, and a lot of other details. And remember that any kind of CPR is better than none. You are protected under the Good Samaritan law for the training that you know. So if you're somebody that knows absolutely no training, you can begin CPR just with these few little facts. You want to check for air, pulsing. You want to check for their pulse, if they're breathing, and you want to start compressions fast. That's all you need to know. So you're going to do that. But say that same person, you're like, oh, I saw in Grey's Anatomy that if I put a trachea in them, then I can help them breathe that way. Say you put the trachea into the patient and the patient dies from that trachea or just dies from the heart attack, then you're liable and can be charged with a lawsuit from the patient's family. If you did not do the trachea, then you're protected from any lawsuits if the patient dies. So remember, any CPR is better than none.